Recently, pharmaceutical industry started to pay more attention to last mile. But what is last mile? There's a lot of confusion when you look at the definitions given by different organizations. In order to understand this last issue, I decided to make a big search. In an internet search, I came across with a lot of movies that are dealing with last issues. So I started watching movies for the last month. And at one point, I came across with a movie that was called The Last Mile. I thought this is the answer to my question. I watched it, but it wasn't. And then I started thinking about pregnancy as a metaphor. Because we all know there is a last trimester in pregnancy. How it is defined? So pregnancy is a period that starts from conception till the delivery of the baby, and it takes around 40 weeks. But the last trimester was from 27 weeks onwards. The first one is between 1 and 12, and the second one is between 13 and 26 weeks. So how can we bring these into the definition of the last mile? When we speak of last mile, there are three components that we have to take into account. The first one is the service provider. This could be a health center, this could be a hospital, or this could be a pharmacy, retail pharmacy. And there are clients, end users, that these service point serves. They are here. And in between, from the service provider to these end users, this is the last mile. By definition, it doesn't need to be 1 mile. It could be 1,000 miles. Let me give you an example. Recently, I came across with a book written by Bengal Decker from the Guardian newspaper called Bad Science. I heard a lot about this book and I wanted to order it. So I go to Fnac in Geneva. That is the biggest bookstore. But they didn't have the book. But they said, no worries, we'll order the book for you. And when the book comes, we'll give you a call. So after some time, I receive a call, the book is ready, and they ask me whether I want to come and pick it up or I want them to deliver to my house. I said, why don't you send it to my house? So here is Fnac, and here's my house. So the book was delivered from here, to my house. This is the last mile. Fnac is the service provider, I am the end users. I could also order this book from amazon.com.uk that is located in London. So here is my house and here is amazon.com.uk. So they sent the book to me by mail. They are the service provider, I am the end user. And this is the last mile. That takes over 1,000 kilometers. From Fnac to my house, it was only 7.9 kilometers. It could also be a prescription given to me by my doctor. So I go to a pharmacy, assume that the drugs are not ready or they have to order. When it is ready, they send it to my house. So from the pharmacy, it comes to my house. Pharmacy is the service provider, I am the end user. Based on this information, let's try to see what could happen, what could go wrong between the service provider and the end user. The most critical issue in last mile cold chain management is the temperature excursions, either high or low. We want to keep our products cool, but at the same time, we have to prevent them from freezing. Otherwise, the products will lose their integrity. There are 4 aspects we have to take into account when we think of last mile cold chain logistics as critical issues. The very first one is knowing the stability data of your product that you're handling. The second one is the temperature monitoring devices that you will select to monitor your product. And the third one is the equipment that you select either to store or transport your product. And the last one is all about reaching the unreachable populations. Now let's try to explain this with examples. I want to bring 2 vaccines manufactured by 2 different manufacturers. Here's one that is lyophilized. And here's the second one that is liquid. Now this product is very stable even at temperatures at 37 degrees Celsius for months. It can be kept frozen, of course, because it's lyophilized. This product is liquid. It also can be frozen without any damage to the product, but it is very unstable at temperatures above 15 degrees Celsius. Now, if you do not know the stability data of these differences between these two products, when they are exposed to same conditions, it's not the same solution that you will have for this product or this product. You need to know the stability data of your product. Now, if you look at the labels of these two products, you read the same information. Store and transport 2 to 8 degrees. Now, if you don't know these differences, you won't be able to take informed decisions if this product is exposed, say, to 25 degrees Celsius for a certain period of time. So it is important that you have to know the stability data of your product that you're handling. When it comes to temperature monitoring devices, you have to select a device that would give you good enough information so you can take informed decisions. For example, STEM thermometer, alcohol thermometer. The only way that this information that you read, what your temperature is in your refrigerator, is to open the door and look at the thermometer. But it doesn't have any memory. It will not tell you what has happened last night, what has happened Sunday. You can only read this information only when you open it and look at it. There are new devices pre-qualified by WHO that gives you more detailed information about high temperatures, low temperatures, to what extent, how many hours, how many minutes, whether these exposures could have a negative impact on the product. You can take more informed decisions. And these devices can also keep the information for up to 30 days. So it keeps the memory for 30 days. So you can refer many times. It's also very good for the, supervisors when they come to a health center, so they can see this information through this memory. When it comes to freeze indicators, there are certain levels in the last mile that you have to use freeze indicators. This becomes more critical if you're transporting freeze-sensitive products in vaccine carriers or cold boxes. It's also important when it comes to choosing the equipment that you're gonna carry your vaccine products or pharmaceutical products, that these are hard case boxes, but there are also versions that are backpack model, that your hands are free, so you can carry other things, and it's more ergonomic. They are light, that allows you to walk longer distances actually. When it comes to ice packs, there are a lot of studies showing that you don't really need ice in transporting vaccines in the country. You can rely on cool water packs. In e-learning library, you will also see some articles explaining this issue. And of course, last but not the least, an even more critical tool is the vaccine vial monitor that is attached to the product at the time of manufacturing, and it stays over there. It keeps all information, what has happened to the product. So when a health worker at the end of this chain, as an end user, as a service provider, sees this vaccine vial monitor, he or she will be able to read what has happened to this product, how it was handled. So it is extremely critical tool in the last mile, especially when it comes to reaching the unreached. One last characteristic of the last mile issue is from retailer pharmacy and health center. These are two different concepts. Pharmacies are passive. When you have a prescription, the pharmacist doesn't know that you have a prescription. It is your obligation and your responsibility to go to the pharmacy to purchase your medicines. Sometimes, yes, there are time and temperature sensitive products, so they have to package this in a way so they are not affected by higher temperatures, but again, they are passive. When it comes to public health services, say health center, if a mother doesn't bring the child for vaccination on time, It is their obligation and responsibility that the health worker has to go out, find and reach these clients. It's the nature of public health programs. They cannot afford waiting over there and putting all the blame of not coming to the end users. And this is an active approach in last mile. Pharmacies, passive. Health centers, active approach. And this active approach takes a lot of effort. Sometimes they go by car to reach these clients, the end users. Sometimes they go by motorbike. Sometimes by bicycle. But most of the time, we're speaking of a pair of shoes. They walk, and this is how they reach the unreachable.